When it comes to keeping or maintaining healthy knees to make sure we don't, again, endure a lot of wear and tear around the knees, which is something that's bound to happen, especially if you're a runner, triathlete, an endurance athlete, or someone that likes to work out consistently, is making sure you have the control in the hip and the ankle. Love looking at the lower leg. It's such an interesting area because just because you have knee pain doesn't always mean it's the knees. Could be the ankle, could be the hip, could be the spine. There's a lot of other areas that really predispose the knee to pain. So we have to look around at other areas just to make sure they're functioning well, to make sure that knee is in a good position, because essentially that knee is just a simple hinge joint. There's not a lot of extra movement to it. Yes, we do have a little bit of internal, external rotation down here at the tibia. We have that rotation and that sharing down there, but for the most part, if we can keep good position at the ankle, the arch, in the hip, that knee actually aligns pretty well. But once I start to lose the position of the hip, maybe it's from a stability standpoint, I'm losing, those muscles aren't keeping me in a good alignment here. I get what's called a valgus collapse. That knee could be trailing inward, again, more stress around the knee, more susceptible to patellar tendonitis, patellofemoral syndrome, those types of things. And also at the foot, because if you notice that arch comes in, if that arch tends to collapse for whatever reason, lack of ankle mobility, could be some weakness through some of the intrinsics there at the foot, or just poor stability in the foot. Same thing will tend to happen. That knee will kind of collapse in here, more stress around the knee joint. So looking above and below is very important from a knee point of view, to make sure that knee is maintaining a good position and not in a poor alignment, in which we have more of this angle as opposed to this vertical line where we're more stacked on top of each other. Next thing to think about is shock absorption. So with running up and down stairs, different things, we need to make sure that our joints are ready to withstand the pounding that we're placing on them, especially if you're a runner and you're increasing your mileage. Have you worked on some jumping and landing to teach your body how to properly compress, absorb, take some of the stress through the soft tissue, and not just continuously pound through the joint itself? So in those instances, what I love to work on is different jumping and landing drills, like your vertical jump and stick, just teaching the body how to softly come down, sit back into the hips, because if you come down here and you let those knees jut forward, any large angles are going to cause more stress around the joint. So if we can come down here through the knee and sit back, so you can see I'm trying to get my shin closer to vertical as opposed to this deep angle going forward. So this jumping and landing drill, landing as soft and as quietly as possible, is good, because you think about running, that cue for running softly to help really minimize that ground reaction force and that stress that comes up the kinetic chain is something you can address within your functional training or strength training program. And then once you go with the double leg version, doing different single leg exercises to now tie together the stability at the foot in the hip with some kind of drill that works on really dispersing the forces up the kinetic chain. So those are a couple different strategies that I highly recommend to keep the knees safe during exercise. If you have any questions, feel free to reach out, leave a comment below, and I'd love to talk more about this.